My name is John Sink, and I am here because I'm donating a kidney in a few weeks. Well, it started, I read a Facebook post from my wife who shared something from a coworker of hers, and her coworker's husband was needing a transplant, so she was essentially using social media as that platform. And I read it, and accompanied with it was a photograph of him and his wife and their 2 children. And I don't know, what's funny is I've never met this man, but the photograph, a lot of it had a lot of similarities with myself because I have 2 small children as well. I just thought that this could easily be me, and all it takes is going to get checked to see if I'm a match. So that's essentially how it got started. I've done a lot of soul searching over the last couple of months because of this, and everybody on this planet is here for a reason. We're all here equally to share this planet, and who's to say my life is more important than somebody else's? And somebody needs help. I'm able to help them physically, so why not do it? I think we're all kind of interconnected in some point of way, and if I can help somebody who's suffering, then why not? Well, I think a lot of it is to bring awareness, because until I read that Facebook post, I honestly had never even considered it because it just never crossed my mind. But then once I read it, it was like a no-brainer. So if more people knew about it, I think it could help. And if this story can help raise awareness and bring more people forward, then why not? To be honest, I've kept it fairly quiet. My immediate family knows, and some coworkers, but other than that, I haven't told a whole lot of people because I didn't really want to tell anybody until it was a final thing. Just because I know it can bring a lot of different emotions to various people, and I didn't want to cause alarm if it was unneeded. I had a lot of medical tests done, ones that wouldn't have been done if I didn't come forward. So it's nice to know for my own end that I'm healthy and I don't have any major problems. But the people at KU have been great. Melissa's been great, and it's been a good experience. Well, once Melissa let me know that it was going to be part of a chain affecting 10 people and 5 people getting kidneys, that was, I guess, somewhat icing on the cake, that it was just going to be extra special. And so I'm really looking forward to it. This is all I'm thinking about these days, and just trying to enjoy the last few weeks with my family while I'm able to and not in recovery and laid up in a bed. I just want to make sure everyone affected comes out of this either healthy or healthier, and that everything is successful. And I really have no doubt that it wouldn't be. So when I was here for the full day evaluation, when Dr. Coomer came in and he said, you're the only guy that's coming here that doesn't need a surgery. And that's true and all. And over the course of it, you weigh the risks and the reward. And like anything in your life, that you encounter risks all day long. And I have to put my faith in the medical professionals who do this day in and day out. I have reviewed statistics, and the odds are in my favor. So that's essentially how I came to it. If there's a 1 in 10,000 chance that this might not go well, those are pretty good odds. And I think the odds of getting into a car accident and on the way to work is probably greater than that. So.
I've known I needed a kidney for about 2 years now. And I've had one kidney since 07, or 09. Had one removed because of cancer. I've been doing dialysis for just a little over 2 years now. It's keeping me alive, so it's not bad, I guess, is what you can say, really. It's a little time consuming, but it still lets me live a natural life, or have, pretty much natural life like I had before. I had to quit my last job I had because I was cramping up all the time. And I just felt like, I can't do my job right. And I know it bothers my wife some, because some things we want to go do, can't do because I have to go do a treatment or something like that. But like I say, it keeps me alive, so can't complain too much.
It actually started when he had his first kidney removed. I told myself at the time at the hospital that I need to be cognitive of it and at least be ready for it in case he needs it. And later, when, I guess a couple years ago, he said his other one was failing, I asked him about the donation, and he said he had to get cleared to be able to receive one first. So I waited until the time that he was cancer-free, I guess, because he just sent pictures saying that, look, I'm cancer-free, and he was all scarred up and vicious looking. And so I pushed him and pushed him until he gave me the number of who I needed to contact, and that just kind of set the ball in motion then.
And the kind of sad thing of it is, after all the blood work and everything, we couldn't find out he's not my son. No, not really.
Actually, the truth is, he wants both of them, and I told him no. So.
Yeah.
You guys don't like each other very much, I can tell.
No.
Yeah.
No. No.
You can tell he doesn't like me. He won't give me both of them.
I don't. I have a rare blood type, and you can match with, I don't know, a lot of people. I don't know what his blood type is. I know mine's rare. I forget what it is, but.
I'm B positive, is what I am.
You positive about that?
Yeah.
Okay. I'm 80 something, I think. I don't know, but I asked my friend Google about paired donations or anything that could happen, and I found some article, and I finally called up here, asked about it, and they said, yes, it's true, we do that, and it was all downhill from there. Everything was laid out in front of me. If I had questions, it was easily answered. So there's nothing left in the dark for me to know about. It helps him, and it helps the other person. I've got no problem helping somebody in need. The main motivation, obviously, is my father and our family, but the benefit of someone else being helped is truly no skin off my back. I've got no problem with someone else getting a kidney. He was slow getting back to me on who to call and who to contact and whatnot. I think he's worried that I might have issues in the future, and that's a legitimate concern. But if you hit him hard enough with a rubber hose, he's going to come forward with the phone number to call up here and who to contact and who he's going through and whatnot.
My mother, she was, elderly, of course. She's about 86 years old, but she had a bad heart, and she started having kidney problems. And I offered her one of my kidneys. And she said, no, if it was just my kidney, I might consider it. But her heart isn't all that great either, and she's lived a long, full life. And then a few years later, I come down with kidney cancer. And all this was kind of going through my mind. What if he gives me one of his kidneys, then later on in life, he comes down with something and only has one kidney? my concern was him. You know, and basically that's all it is. You know, I love him, and I don't want anything to happen to him. You know, look at that face. How can you not love something like that? I mean, it's. But that's my main concern there. Well, I talked to his wife's son about it. I don't know if he knows about it. And his wife said, hey, we have 3 children. You know, surely we can get a kidney through that way if something was to happen to him. She said, don't worry about it. That's be our problem there, that we have to figure that one out if the time ever came. And that made me feel a little bit more at ease. But I'm like him, you know, he's not only helping me by giving his kidney to someone else, but someone else is helping someone else. It's just it's a domino effect. And it's amazing that people are willing to do something like that. It really is. He and I were just talking about this downstairs a little bit. Are you nervous yet or getting nervous? I'm not nervous yet, no. I just hope everything works out all right for everybody that's getting one that day and giving one away that day.
I felt like, and I was telling my wife about this the other day, I feel like I am the patient when dealing with the staff here. They make me feel at home. They answer all my questions. It's almost a surreal feeling of, wait a minute, what am I doing? But I know what I'm doing, but they make me feel so welcome and comfortable that it eases all my tension away.
I agree, yeah.
So that has definitely helped. It's one-on-one, it's any questions answered. There are no secrets with this. They look out for both the donor and the recipient at the same time, and it's a fantastic feeling.
You admire superheroes, and you're going to be one. What do you think about that?
He is one.
No. Some people would say that, sure, but I don't look at it that way. I just look at it as just doing the right thing and helping a couple people out. I have the organ. I'm not the one moving it, so maybe the doctors are and the nurses and all the staff. So they're the ones that went to school.
It's a serious thing, but like I say, there has to be love involved in there, or else it wouldn't be happening.
What is your plan after you get your kidney and you start feeling better?
Oh, shoot.
He said the other day he's going to Disney World, but...
Yeah. I really can't say because my wife is around the corner and she'll hear what my plan is. But no, I start doing some of the things that I really couldn't do to the fullest before. I want to get out, and I love hunting and fishing. I haven't been able to do any hunting since this, and very, very little fishing because time involved. But I want to get out and do some of that and spend more time with the grandkids.
Maybe take all of them to Disney World.
Yeah. Well, I can't take them to what was that Joyland that we used to have in Wichita. But
Yeah.
I can't take them there anymore. That's closed up. But yeah, do something fun with them.
9, 12, and 18. The 12-year-old is just kind of like, okay, whatever, go for it. The 9-year-old had some questions, and I tried to explain to her the way it was going to work. I drew out a little diagram of, I'm going to give to this person's going to give to this person, and went back and forth. And she says that she understands, but I never know with that child. So she's not worried. None of them are worried. So I think they would worry if I were to worry or if Mom were to worry. And so far we haven't shown anything, and so far I'm not worried. So.
And the oldest one, what have they said? Girl or boy?
Boy, and hasn't said much. He's just kept quiet about it and just kind of, he knows once I make up my mind that's what's going to happen. So he's just kind of going along with the flow.
Well, I said that I feel like this is the right thing to do because Cammie needs a kidney, and the good news is I am a match for her, and it just felt like I was healthy enough and in a situation where I could do it because I'm not employed outside the home, so I could take the time off, and that I was going to donate my kidney to my friend Cammie. And some people were shocked, some people were excited, some people were confused. But overall, everybody was really excited that I was taking this step. A couple people did say that. Are you crazy? And aren't you nervous? And are you sure that's what you want to do? And what if we don't think it's a good idea? And as my husband said, when I make my mind up to do something, I usually do it. So that is what has felt like the right thing to do. He tends to worry more, and so from a health perspective, he would be worried about me, but he understands why I'm motivated to do it. Both Cammie and I are social workers, and as a social worker, I'm always looking at ways to make a difference and to help others. And when she and I were presented with the opportunity to help more people with the donation, where my kidney would not go to her but to somebody else, she and I both said we can't say no, because then more people are going to get a kidney and have a better life with that. Well, it's confused him more. It's like, I don't get it. What do you mean? Your kidney's going to 5 people? And I said, no. My kidney's going to one person, but and I use it like a matching game. Like when you do an 1, 2, 3, 4, 5 and an A, B, C, D, and E. In order to match, we have to cross through them to get the 5 kidney matching together. And so then they kind of get it. They're like, oh, so 5 people are going to get a kidney, and there'll be 10 surgeries within a couple of days. And then it's even more exciting. In fact, if it doesn't work out, I think I'll be disappointed because the 5 plan seems even better, knowing that Cammie will get her kidney. More lives are being saved, and more people there's more awareness out there, and more donors and more recipients, and that's the ultimate goal. My life should not be different. I feel like it's a short-term pain and inconvenience in my recovery for a long-term gain. And then I anticipate my lifestyle to be the same with 1 kidney. I've heard people say, my daughter was born with 1 kidney and she's been fine her whole life. My son donated a kidney to a colleague a couple years ago, and he's an avid runner. So from everything I've heard and learned, including knowing my own health, with low blood pressure and some other good variables, I don't anticipate a problem. We met in 2004. We both worked for the same agency in Wichita. We were at different sites, but we were both social workers. And then we became friends as time went on, and we ended up crafting together. We've traveled together. We get together with our spouses. She has 2 young sons, and my children are similar ages. In fact, her son lived in the same house with my daughter for a year at K-State. So the friendship has just really developed over the years. She has not been very healthy since I've known her. So I've seen her deterioration in health. So it wasn't a surprise. And actually, I knew she was getting on the transplant list, and I knew she was taking some steps, but it wasn't until April of last year that she and another friend and I were together, and we're like, who do we need to call if we want to be a donor? And she goes, oh, I can't ask you to do that. That's not comfortable to me. People, that's really hard for me to say, please donate for me. So the other friend has some health issues and wasn't even a candidate. But I took the card, and I was like, I wanted to pray about it, reflect about it, do a little research to feel like if it was the right thing to do. So I took a little while to pursue it, and then pursued it, and then I came here for pre-testing in July to find out if I was a match and if I was a healthy enough donor. And everything was a go at that point. So I always knew she had issues, but it didn't really click that I could be an instrumental person in helping her. I used to work in adoption, and I am open to whatever the recipient is comfortable with. If the recipient wants to meet me and connect, great. If the recipient feels uncomfortable with that, I will respect that. I, of course, have hopes and dreams that the recipient benefits greatly and that this person lives a long life and my kidney is useful. But either way, I know it's worth a try to help that person. It's brought us closer, of course, and it probably will continue to. I kind of feel like I should have access to her medical records. But that's a little too much. So yes, we have enjoyed the relationship, and she and her husband and her rest of her family are, of course, very appreciative, and I know it means a lot to them. I'm not doing it for that, it's just an added bonus. By paying it forward, doing the right thing is going to help our families continue to stay close. Well, that was one of the questions they asked me, what if Cammie does things that her lifestyle aren't, supportive to maintaining her kidney? And that's the way it is. We all have hopes and dreams for ourselves, and I know she will do her best and take it seriously. But again, she's not technically going to get mine unless there's a problem, so we'll see. When I first called Melissa, that was my first question. I'm 55. Should we continue talking or are we done? And she said, no, we can still talk about it. I had to do a few more things. I had to do the stress treadmill test because of my age, but I was very excited and proud that I am healthy at this age to be able to do it. Because that's another thing. People think I'm too old, I can't do that, and look at me. Melissa's been wonderful to work with. She's energetic, happy, joyful. She's very supportive. She's always made it very clear. This needs to be what you are comfortable with. This needs to be in your comfort zone. And when I first called into the screening over the phone, I did my medical history, and there weren't any red flags from that with the medication I take and different things like that. And then I did the blood pressure checks for 5 days, morning and night, 12 hours apart. And I know I have low blood pressure, so I knew that was a big plus. I did not realize how much the kidney is a factor in blood pressure until this process. So with my low blood pressure and my medical history, there weren't really flags. Then I did the urine collection, came in. Overall, I've gotten a very warm, receptive, your health's okay, and you're looking good. So on the treadmill test, they asked me during it, do you want to stop? And I said, no, let's keep going, let's keep going. So my goal was to max that as well. And I passed everything without big concerns or hiccups.
My name is Sean Dawes, and I'm here for a kidney transplant.
And my name is Jennifer Dawes, and I am here to be a donor. I think it's just really important to get it out there because I've experienced what he's gone through being a spouse of someone living with kidney disease and having to watch every evening him hook up and do dialysis, and it's just been really tough. So
Excited, nervous. It's a bit of a surreal process, I guess I would say. It's humbling that people are willing to donate a kidney to someone that they don't know, or just the whole cross donation. But yeah, excited, nervous. I'm not sure where I would actually pinpoint it.
I think most of the family has been very excited about the process. A little nervous with both of us having to have surgery at the same time, but understand completely why.
The eyes have shot open when we've told them it's 10 people. They're like, how often does that happen? Is that normal? No, it's rare, but exciting. So
I told him about a year ago today when we first came to KU Med and went through the whole process, and him finding out that he was in fact going to have to be on the transplant list, that I would do anything and everything for him. And we waited a few months to see if anything came up with a donor, and nothing did. And so I talked to him and told him that I would be more than happy to go through the process, even though I knew I wasn't a direct match, just that I would try my hardest to help in any way I could.
to me, it's crazy. I mean, it's a connection you'll have with somebody for the rest of your life. That, like I said, it'd be it's something cool just with a basic cross donation. If it would just be you and one other couple, that you would all still be connected, but to have so many people impacted by the end of it, it's crazy to think, and it's pretty cool. So
not too many people know about
Yeah.
kidney disease as a whole, and so
and I think just a lot of people just don't know necessarily what to do.
Yeah.
So I know for me personally, I had more people when they had found out what was going on with me, that their initial reactions was, oh my gosh, what can I do? I want to donate, but then they had no idea what to do, what steps to take. But it was, like I said, a humbling experience to see that many people say, I want to help, and just needed the information and the know-how.
I'm getting a kidney transplant because I was born with only one, and we actually just found out about 8 years ago that I only had one. So it's failing right now, so I was lucky enough to get a donor. I got the call when I was at work, so it was kind of a total shock kind of thing, because one, it's like shocking that it's a living donor to begin with, because this whole chain situation is so rare that it was like took a moment just to process that this is even happening, because I've waited since December of last year on the list, just waiting for, a donor. I've had my family members and stuff tested, but they ended up not being a match. So this was just like a blessing in disguise that some altruistic person just came forward and wanted to give a kidney, which was amazing. I mean, it's literally life-changing. I mean, because I'm only 29 years old and feeling, it's just bad feeling sick all day and like being tired and like you kind of feel like you can't really live your life the way you want to. So just the fact that they're willing to come forward and like give me this kidney is kind of just completely life-changing for me and basically giving me my life back. So it's just amazing that they can see that need that's out there and are willing to help somebody out in need, which is just fantastic, I think. I mean, it wasn't ever like bleak, but it was definitely disappointing, because like with every test, you kind of get your hopes up that this is going to be the one, it's going to work out. And especially with one particular test, they kind of went through the whole process and then they were, they couldn't do it at the last step. So it was kind of like, you're really hoping, and then to be told no is just kind of a letdown. But, I understand why KU has such, and I'm grateful KU has such strict standards about it, that I'm only going to get like the best kidney no matter what. I mean, I already know that I'm going to have another transplant within my lifetime, but because KU said that the deceased donor rates are like 10 years, but with living donor it's like 15 to 20 years. So that gives you an extra 10 years basically of you don't have to worry about that kind of thing. So, and you have way better outcomes too. So it's definitely a bonus. I was about ready to like start dialysis, which is another why this timing is just perfect. Because I was talking with my nephrologist and he was saying I was having some of the telltale symptoms that, they look for, and they said I was about a month away from starting dialysis. I mean, I would just be like so grateful. I just ought to, first off, just say thank you, just for being that amazing altruistic person willing to give up your kidney to help save mine. I mean, it's amazing that they would do that. I mean, like I said before, I just feel like they're giving me my life back, pretty much life that I want to live, kind of thing. So I'm so grateful and so blessed that they're this amazing person to do this. Honestly, I would say like if you would just take the first step, the simple first step of putting an organ donor on your driver's license. Be willing to do that, because honestly, if something happens, the worst happens, and you pass away, you're not going to use those organs at all. You could be helping so many more people and giving them, their second chance or whatever at life. So it's so important just to get the education out there and educate people that, it's not scary, it's not horrible, it's very easy, and KU's very good with their transplant process. So I think just the more information you can get out there, the more people donate, it'll help change so many people's lives that really need it. Oh my gosh, I am so excited. Like, I can't even. Every time somebody mentions my transplant, I just smile because I'm so excited. I can't wait.
My name is Dr. Amna Elahi. I am a nephrologist and part of the living donor team. So kidney transplant is the best treatment for kidney disease. There is a big gap between the demand and supply of kidneys, and one way to bridge that gap is to do living donation. Living kidney donation is a very safe way for a loved one to get a kidney, and the people who are eligible to be kidney donors are usually very healthy adults above the age of 18 who are able to consent and overall have a very healthy lifestyle. Usually, once a person is chosen to be a kidney donor, they go through a very rigorous testing to make sure that they have adequate kidney function. And after donation, of course, initially 50% of the kidney function is lost, but the remaining kidney is able to make up for it, and usually about 75% of the kidney function comes back on that living donor within a few months. If a person is healthy, continues to stay healthy, they will be able to live a very normal life with that one kidney with minimal side effects. Every surgery itself in the beginning, of course, has its own risks, but in the long term, kidney donation is a very safe option and very safe for donors. So John is a very healthy male in his early 40s who has no history of diabetes, no history of hypertension, does not smoke, has a very healthy weight, and that makes up for a good donor. His lab work also showed that he had very good normal kidney function, which is a requirement to become a kidney donor. Kidney donation is overall in the long term a very safe process. Of course, initially there are risks associated with surgery, but once a person is over the initial surgery period, they recover very well. Initially, they have to have lifting restrictions, and for the first 4 to 6 weeks, of course, they have to rest at home, but after that they can go on and live their normal life as they were doing before. Kidney donation, a kidney transplant is the best treatment of choice for somebody with kidney disease. And living kidney donation is one of the best options. It is the safest option, and the quality of the kidney is excellent, making it last very long compared to a deceased donor. At this point, if they do not have other living donors, then they would have to wait on the kidney waiting list until they got a deceased donor offer. So whenever somebody is wanting to donate to their loved one, they do not have to be a direct match. They can be incompatible, secondary to blood type or antibodies. And unfortunately, they will not be able to give directly to that person. Kidney pair donation is a program that is a very safe alternative for these people, where our center participates in a national kidney pair donation program where these incompatible pairs are placed on a list, and essentially kidneys are swapped, where a person donates to a stranger, whereas a stranger donates to their loved one in return, and more transplants can happen. This is a very safe alternative, and yeah, this is a very safe alternative. John is a altruistic donor, and through his selfless act and extreme generosity, we were able to start an internal chain. We had incompatible pairs sitting in that kidney pair donation pool, not being able to get transplanted, and by using him as a starting point, we were able to give kidneys to 5 pairs internally, and by swapping kidneys with each other. Through the extreme generosity of John, we were able to start this internal chain, and 5 people's life would be affected for the better, and they would be able to get kidney transplants. We had 4 incompatible pairs versus 1 was a compatible pair ready to go for surgery, and we brought this, we put them in this mix and asked them to be a part of this chain where they would not directly donate to each other, but get a kidney, give a kidney to somebody else and get another person's kidney. And they generously accepted this offer, which actually helped us make this all possible. Living donation is a very safe and effective way to help kidney disease patients who are in need. It is a very safe alternative which makes a big difference on the recipient end. It gives them more quality and quantity of life, and it is living kidney donation is a very selfless act and the best gift that anybody can give. We I love being a part of that whole team, and being able to make a difference in patients' lives. We as a transplant center are very humbled to be a part of this and are very excited to make a positive difference in these patients' lives, and we really hope that all goes well.
My name is Melissa Fowler, and I work in the Transplant Center as a Living Donor Coordinator. Here at the Transplant Center, I work with potential people interested in being a living donor for a friend, a family member, or we also sometimes have people come forward that are just interested in donating but don't have a specific person in mind. So I help them get through the process from the time they originally call our Transplant Center until the time that we give them a decision on whether it's safe for them to move forward as a donor. And then if they elect to move forward, we help them through that coordination of surgery. But ultimately, helping the living donors, the ultimate impact is not just to allow those living donors to move forward, but then it impacts the person who's in need of a kidney in the long run as well. John has been phenomenal through the whole process. Originally, John came forward to help out someone that he had met through his wife. But during that process, we already had another donor that we were hopeful would be the direct match that we needed, and John was not a match for that person he originally set out to donate. But then John came to me and said, you know, I'm still committed to finding out more about this process, and I'm still interested in potentially helping someone else. And so I talked through some things. We started the full clinic evaluation, where we screen someone head to toe to make sure it's safe for them to move forward as a donor. And ultimately, John said, yes, I'm committed to doing this. And he is a huge, huge puzzle piece in all of this to make all of this possible. In the world of transplant, people who are in need of a kidney that set out to find a living donor ultimately Try to find a donor that's healthy, but then also what they're looking for is someone that is what we call compatible, or where they're able to directly give to the person that they want to, whether that's a friend, a family member, or whatever. But sometimes people are not a match to give to their loved one. So what can happen in the world of transplant is we can look at doing what we call paired donation, or also looking at chains. And that's essentially where when someone wants to give a kidney to someone but they're not a match, we can potentially match them up with someone else, whether that be here at KU or on a national level. So for instance, if I wanted to give a kidney to a friend and I wasn't compatible to give to my friend, but maybe somewhere else here in the area there's another set of friends that want to give a kidney to each other but they're not a match. For lack of better words, we can essentially swap kidneys to make it work. So we can take that one step further from paired donation, and we can actually, when we have an altruistic or anonymous person come forward that's willing to donate but doesn't know a specific person in need, we can start a trickle of events or a chain of events where we can potentially get more people transplanted. And so with that, we just find a way to essentially crisscross people to get them matched up with someone who they otherwise wouldn't have received a transplant from a living donor. So ultimately, the people that come forward as donors, their loved ones are still getting a kidney from a living donor, and we hope they have better outcomes. We've just had to go about it in a little bit more of a non-traditional way. It's been a very exciting time to work on coordinating a chain. There are, of course, a lot of logistics and planning that have went into the process. But ultimately, what drove this process for me, as well as a lot of the other members on the team, is ultimately knowing that we had several donors that had been approved to be healthy kidney donors for their loved ones that weren't matches. But how can we find a way to shake this up and get these people to match? And ultimately, what it boiled down to was having all of these fantastic people willing to donate and finding a way to crisscross them and make it work. And so as we started pulling through the layers and started to figure this out, it became very exciting, and was definitely a very well planned, thought out process before we went to all the donors and the recipients saying, hey, we have a potential chain. There was a lot of legwork that went into it before we even approached everyone to see their thoughts. With all the living donors and all of the recipients in this equation, I just really want to help them through the process. It's a nerve-wracking time. You know, everybody has an upcoming surgery, and so just to help them feel as calm as possible to get through the process, and to be here as a sounding board to ask any questions and really just help ease any fear or anxiety that they have. It's normal that we have some fear and anxiety through surgery, so I just want to give them all of the information I can to help them get through this process the best possible. And ultimately, the donors in this equation, ultimately they're just setting out to help a friend or a loved one. And I'm impacted by kidney disease in my family, and it's super important for me to one, keep a donor off of, we never want to put a donor at too high of a risk of developing their own kidney disease in the future, but ultimately helping get people off of dialysis or not starting dialysis. So ultimately, just to walk people through the process and let them know the outcome that we're all hoping for. We're all working towards the same thing that day or the coming days. All of the physicians, all of the staff members, all of the support staff, all of the donors, all of the recipients, our entire team is all working for the same thing, for everybody to have a good outcome in the equation. I have been working in the transplant center as an RN for a few years. Originally, I started off helping the individuals who were in need of a kidney, so what we call a recipient. Was really driven to help the transplant population, as I've been impacted by a loved one with end-stage renal disease who's on dialysis. It's my father. Unfortunately, transplant is not in his cards, but it really helped drive home for me where I was supposed to be to help people get through that process. After working with the recipient population for a while, I transitioned over to the living donors side and tried to help donors get through the process. And ultimately, two things drive me every day, and I tell the donors this. I have two goals. We keep the living donors healthy and safe throughout the process. We don't approve people to be approving people to be donors. We want to make sure that the risk for them developing their own kidney problems is low. And then secondly, ultimately it can impact the recipients or the people in need of a kidney. And we do think that, or statistics support that people who receive a kidney from a living donor overall have better outcomes and better results. So that's what drives me every day, is to give people the best possible outcomes in a safe way. I just want to thank all of the donors and all of the recipients for trusting in us for this process. Without 10 amazing people, this wouldn't have been possible. So thank you to everyone for allowing us to go on this journey with you and having trust in our team.
Hi, I'm Dr. Alani. I'm one of the kidney doctors.
Yes.
How are you?
I'm great. How are you?
So I know you're here to learn more about kidney donation, and we'll start with some of your history. So tell me a little bit about yourself. Is it told that you have a history of high blood pressure, or you've been a pre-diabetic?
No.
Do you exercise?
Yes.
What do you do?
I run a lot and I ride bicycles a lot.
Oh, okay. And allergies?
No.
Do you take any medications?
Yes. Yes.
Any past history of surgeries? Over-the-counter medications called NSAIDs like ibuprofen, Aleve, Motrin?
Occasionally for a headache.
Approximately. Okay. Have a seat. Move forward a little. Take a deep breath. Again.
Hi, John.
Hi.
Good to see you today.
How are you?
I'm good. How are you doing?
I'm doing well, thank
Good.
you.
Are you getting excited about this?
I'm very excited.
And still on board to move forward?
Yes.
Good deal. We're recipients, and so we definitely appreciate you making all of this happen and being one of the missing links to put the puzzle together. We've already done a chest x-ray, so we don't need to do that today. You've already met with our social worker and donor advocate. Would you like to meet with them today for any other reason? Okay, so the day before surgery, and they'll tell you exactly where to check in and what to bring with you that day. So,
excellent distance here. And then I'll need you to take some big deep breaths while I'm listening. Okay, go ahead. Excellent. Again. Sit back and relax. Arteries, and then when I ask you to take a deep breath.
Okay.
Okay. Find them first. Pregnant or after surgery or
No.
any other time? Okay.
all right, Miss Beth. Now we have the papers in front of us, so
That's
that'll be
right.
easier. All right. Okay, let's get this one out. Okay, so
Thank you.
between now and the day of your surgery, if you get sick with cold, fever, flu, nausea, diarrhea, please call your surgeon's office. Don't come in sick. We ask that you please do not eat or drink anything after 11 p.m. the night before your procedure, including please don't come in with gum, mints, or candy. You may have sips of water up to 2 hours before you need to be at the hospital.
Okay.
Admissions.
Okay.
Which is next door.
Okay.
And then wear in loose, comfortable clothing to your abdominal area because we want to prevent skin infections.
Absolutely. Okay.
Do you have questions?
I do not. Thank you.
Okay.
First, I'm just going to have you spell your first and last name.
Bustin Belton.
Can I do your blood pressure on either arm?
Yeah.
Okay.
Is it right okay?
Yep, that's great. All right, just relax your arm. Or oxygen on that finger there. And temperature under your tongue. Okay.
I'm Jill. I'm going to be your nurse today.
Dustin.
Nice to meet you.
Nice to meet you.
All right, Dustin. It is Dustin James Belton.
Yes.
Kind of look at everything we've been doing to you today. Go through a little instructions with you. When
Okay.
I'm done, a pharmacist comes in. They'll go through all your medications with you. Have you ever been required to see a heart doctor?
No.
No. Ever experience any chest pain?
No.
Do you ever, with your seasonal allergies, do you ever have to use an inhaler?
No.
Hey, Mr. Belton.
Hello.
How are you doing, sir?
Good. How are you?
I'm doing well, thank you. My name is Peter Sullivan. I'm one of the anesthesia residents.
Okay.
And I understand, what procedure are you having?
Give it an organ.
Good deal. I'm just going to run through head to toe just to go over your medical history, okay?
Okay.
Are you pretty active?
Yes.
Good. Able to climb up a few flights of stairs without getting short of breath or any chest pain?
Yeah.
Okay, good.
Nope.
Nope. Okay, after me, the pharmacy is going to come in and go over some stuff with you and kind of give you a little what to take the day of surgery and what not to take the day of surgery.
Okay.
Hello.
Hi.
You're Mr. Belton?
Yes.
I'm Alicia. I'm one of the pharmacists.
Okay.
I'm just here to look over your medications.
Okay.
Make sure they're current and up to date, and then kind of talk to you about what to do with them between now and when you have anesthesia. Perfect. This is what we'll have available while you're here if you have to stay inpatient. So I'll print all this out for you. Between now and your procedure, we do have folks that stop most all vitamins, supplements, and herbal products. So for you, that's the multivitamin. So.
Come on back. You can sit in this chair. You can have a seat wherever you'd like.
We're out there.
All right, just relax your arm. Put that on. Oops. Finger. Put your temperature under your tongue.
It was up a little bit this morning.
What's it normally run?
All right. Hi, Mr. Belton.
Whoa.
My name is Joe, and I'm one of the pharmacists in the clinic. And I just want to make sure that the medication list that we have in your chart is all up to date with how you're taking things at home. And then I'm going to give you some medication instructions for the procedure, but we will talk through it. So if you have questions, we'll cover all your questions you may have, okay?
All right.
Dry beans.
Yeah.
What's out of curiosity, how did you come across that? You do this in the morning?
Yes.
And is that also like your metoprolol? Do you cut that in half?
Yes.
If you have any questions or if there's any med changes, let us know.
Okay.
But don't hesitate to reach out to us. We just don't want you to feel like any guess on anything, and there's plenty of resources, okay?
Right. Okay. Sounds good.
All right, well, it's a pleasure to meet you.
My pleasure.
Yeah, have a good rest of your day.
I will. You have a good weekend.
All right, you too. Good day for you. Sometimes it's a little chilly back here. Let's get some extra blankets.
All right, we're in the room at 7:30 on the dot.
Yes. Here.
How about this?
There you go.
Can run the TDS and then micro micro.